Welcome to the Potter Blog site, January 12th, 2014. The common cold may have helped infect the Canadian-Chinese lady who recently died of H5N1. We base this on information obtained out of this email on the ProMed list server. We have a link to this on our webpage. But in short, what it comes down to is she was found to have a human coronavirus 229E in the nasopharyngeal swab that was taken from her, but not in her lungs. Supposedly they didn't observe any coughing, but they did report vomiting. And so anybody who shared that aircraft restroom with her should be extremely concerned. Now the human coronavirus 229E is commonly referred to as part of the common cold family. And so it generates common cold symptoms, although it also can generate other symptoms. It was not found in her lungs, which should be noted. Now, given the lady's lack of exposure to poultry in Beijing and the lack of reports of H5N1 in Beijing, this common cold virus and the H5N1 combination are prima facie evidence that she was infected by H5N1 via a person who was subclinically shedding the bird flu, but who was also simultaneously clinical for common cold symptoms. Which thereby allowed the H5N1 to be readily transmissible and yet present subclinically. So in other words, somebody who had H5N1 but didn't know it, but also had the common cold, was sneezing and coughing up the H5N1 virus, even though it was not killing them. And she was exposed to this with evidence generated by the coronavirus, common cold virus, found in her nose, but not her lung. Now, none of this excuses the fact that the Canadians were FOA, flat on their ass with helping this poor lady out. And the incredible thing is she was diagnosed with pneumonia after her return from China, but she was not given the option of any antiviral treatment. Now, you have somebody who just came from China, they have pneumonia, and you don't put one and two together and say, well, let's give preventive antiviral treatment and then test her later. No. You wait to see if she dies and give her the more common bacterial treatment and see what happens, thereby potentially exposing the whole North American continent to this and all the people that she had in contact with over the 12-day period when she was possibly still shedding. Now, the reason they can do this, or the reason they do this, is because Canada has a universal healthcare system, like, unfortunately, we have now with Obamacare. It ends up being more economical and effective to let a few sentinel cows die off and trigger a public health response in the aftermath than it is to proactively treat, test, and investigate a cow that might be the sentinel of an unusual outbreak. These universal healthcare systems, in reality, all they are is a veterinary-based herd system. Now, the key with getting people to buy into this is that the government has to hide the decline of the system as it switches from a patient-doctor healthcare relationship to a government-doctor herd-based system, while simultaneously making each individual in the herd believe that they're going to get medical treatment as if they were a prized heifer. So what's clear is that their universal healthcare system did not give this poor lady a fighting chance. And she should have been offered antivirals, and they should have performed flu tests. And they should not have exposed North America to 12 days of whatever she had. But if you read this ProMed email, you can see the Canadians are singing the praises of their response, and that they found something they shouldn't have found. The truth is, it was an abject failure for both the lady who died and the public who believes the authorities have any capability to actually prevent the import of a deadly disease or stop it immediately after it enters. Now, don't be surprised if H5N1 has made it into the Canadian ecosystem. And don't be surprised if there are already several hidden cases of H7N9 bird flu in the Seattle and Vancouver areas. Now, that's the more deadly and so far more commonly obtained H7N9 bird flu. They don't find these things unless they look for them, and they don't look for them unless they have a very specific reason to look for them. And it's just a cluster mess. And unfortunately, because it's a universal government-based system, I don't think this poor lady's relatives are going to be able to sue these people for malpractice. Now, it's not so much that they get reimbursed for the government for what we see as an abject failure in our healthcare treatment. It's more so that these people learn that it's more expensive to treat people as they're part of a herd instead of looking out for them as individuals.